Hello, everyone, and thank you for joining us. My name is Jennifer Blatherwick, and I'm the BC's Parliamentary Secretary for Gender Equity. My pronouns are she, her. Before I begin, I'd like to acknowledge that we are on the territory of the Lekwungen-speaking peoples, the Songhees and Esquimalt nations. It's an honor and a privilege to be here on their lands today for this announcement and to work on these lands each day. I'm joined today by Minister Mark Holland, the Federal Minister of Health, Minister Josie Osborne, BC's Minister of Health, Andrea Rigel, Director of Policy and Campaigns for the BC Health Coalition, Dr. Rachel Olivier, the nurse practitioner and women's health scientist at BC Women's Hospital and Health Centre, as well as members of Parliament, Ron McKinnon from Coquitlam, Port Coquitlam, and Wilson Miao from Richmond Centre. And without further ado, I would like to invite Minister Mark Holland up here to share why we are all here today.
Well, thank you so much. It's such an honor to be here today. C'est un jour historique pour la Colombie-Britannique, mais aussi pour le Canada. Et certainement une cohorte sur l'assurance médicaments et la prochaine étape de la transformation de soins de santé au Canada. Et c'est absolument essentiel que tout le monde, partout au pays, peut obtenir le médicament qu'ils ont besoin. And so today is another step forward in making sure that Canadians get all the medicine that they need. And we recognize that that is an iterative journey. And today that takes a huge leap forward. You know, I want to recognize my colleagues, Wilson and Ron here, who fought so hard for this moment and are such believers in pharmacare. It's been a pleasure, along with our BC caucus, to work with you on this. I also want to take a moment to thank Peter Julian, who is both the House Leader and the health critic. And so we had an opportunity to work on this. Now, Peter would know, and then I'm coming over to you, Josie, here. But Peter would know, typically it takes 18 months to get to royal assent for any bill. That's the average length of time. Folks, we're just a couple of days past 1 year since we introduced legislation. And here we are announcing deals, implementation, first with Manitoba and now with British Columbia. But Josie, I want to say, BC kind of was first because we announced the Memorandum of Understanding with Adrian Dix. Adrian, who is a phenomenal partner in this, and Josie, you've been a phenomenal partner in understanding that people need to get this medication, not just as a matter of fundamental justice, but as a matter of cost reduction. This deal is $670 million over 4 years to provide universal access to contraceptives and diabetes medications, devices and supplies for residents of BC, to ensure the nearly 550,000 British Columbians with diabetes can have access to essential medicines. And I want to say that just on that point, diabetes costs this country about $30 billion a year and rising. We have to cut that curve. And it's so frustrating to me when people talk about just the cost of implementing this, because yes, there's that patient in front of a doctor who gets a diagnosis and desperately needs that medication. But what is the cost when they're not able to get it? How many doctors do we speak to who are so frustrated because the patient in front of them can't afford their medication? And the impact of that is loss of vision, loss of a limb, a worse chronic disease, or God forbid, death. But today we're also here to announce two other things. One is the support of reproductive freedoms for more than 1.3 million British Columbians. We will very soon live in a day where every woman, everywhere in this country, but certainly it's the case here in British Columbia, that women will have complete autonomy over their own bodies. Women being able to have access to reproductive medicines is freedom. Freedom over the decisions to what to do with their bodies, whether or not they want to start a family, and it's absolutely critical. And I'm so happy today, as we announced in the Memorandum of Understanding, hormone replacement therapy to treat menopausal symptoms. You know, being a senior is the one demographic we're all going to join if we're lucky. And going through menopause can be very challenging. And for women who don't have access to money to be able to pay for that medication, it can mean that they're sidelined from being able to take care of their families. It can mean that they're not able to go and be productive, go to their jobs, and be able to live their lives. We have to imagine the cost of this. So when we think about how this builds on the other work that we've done, the work that we've done in dental care, now 1.5 million Canadians across the country having access to dental care. These are fundamental transformations that are moving our system from a system of illness to a system of wellness. So coverage for these products are going to begin in March of 2026. And I also want to say that this is really a conveyor. We talk about a conveyor belt of progress. British Columbia has been an amazing partner. This was the first place that we signed the Working Together agreement in terms of transforming primary care and giving dollars towards doctors and nurses. We signed the first Aging with Dignity agreement. This builds upon, in July, the Drugs for Rare Disease agreement that was also signed. The personal support, we call them personal support workers. I think you call them community health workers. So the deal we signed on that. So we've had an incredible partnership. And Josie has just been a phenomenal partner, new to this health portfolio, but full of passion, somebody I have such respect for and have loved working with. And with that, I turn it over to the Minister of Health for British Columbia, Josie Osborne.
Thank you so much, Mark. It's such a pleasure to have so many incredible guests behind me, as well as being joined by a number of my colleagues from all sides of the aisle here today. And I want to say, first of all, how much it is an honor to be here on the lands of the Lekwungen-speaking peoples. And I really want to acknowledge them, the people we know today as the Esquimalt and Songhees First Nations. It's a real privilege to be standing here and building on the incredible work that Mark and Adrian and their teams have led to get us to this point today, talking about a significant step forward in public health care here in British Columbia. And of course, making essential medications, whether they're needed for preventing unintended pregnancies or controlling chronic diabetes, managing menopause, making this more accessible and more affordable is an incredibly important priority for our government. The rising cost of living can create very difficult choices for people, but health should never be something that people have to compromise on. Nobody should have to choose between putting food on the table or accessing medications that they need to live a healthy life. And that's why I'm so proud to be here with so many guests today and announce together with Minister Holland that BC and Canada have signed, or actually will shortly sign after this, a long-term agreement to improve universal access to free medications. And it really is another milestone in our efforts to continue improving BC's public healthcare system, one where people can get the essential medications that they need without having to pull out their credit card. The agreement provides British Columbia with $670 million of funding over the next 4 years to provide universal access to free contraceptives, diabetes medication, devices and supplies, and hormone replacement therapy. And it builds on the steps that our government has already taken through BC's PharmaCare program to make essential medications and medical supplies more affordable for people. Again, I really want to thank the work by my predecessor, Adrian Dix. He really spearheaded this, and I'm really fortunate to be able to build on that today. Now, nearly 550,000 people, that's 10% of British Columbia's population, are living with diabetes, and that makes it the fourth most prevalent chronic disease in the province. The cost for diabetes medication for a person living with type 1 diabetes can be as high as $18,300 a year. And for those who are living with type 2 diabetes, it can be as much as $10,000 a year. So thanks to this federal funding, we're going to be able to cover diabetes medication costs for everyone in British Columbia free of charge. And of course, British Columbia is proud to have led the nation in being the first province to provide free contraceptives to our residents starting back in 2023. We also expanded pharmacists' scope of practice so that they can prescribe contraceptives, and that makes access even more convenient. Birth control pills can cost up to $300 a year. An IUD can cost $500 each. And last year, in 2024, we provided more than 227,000 people with access to free prescription contraceptives, helping people save money, helping it make it easier to get access to this. With the introduction of the Federal Pharmacare Act, these expenses are set to be covered by the Government of Canada as part of today's agreement. And because we're already providing this free prescription contraceptive access, then we are able to expand, as we've already heard, to expand coverage for hormone replacement therapy for medications that help treat the symptoms of menopause. And of course, menopause is a universal experience, with 95% of Canadian women reporting an average of 7 different menopause symptoms. And that can range from hot flashes and sleep disturbances to brain fog, anxiety, joint pain, and more. Many trans women and gender diverse people also experience menopausal symptoms throughout their lifetimes. And we're going to be able to ensure that hormone replacement therapy is covered up to 100%. And that'll help approximately 160,000 patients across the province save money and improve the quality of their life. And of course, that's really what this is about, improving lives. Today's agreement between our province and Canada is more than just medication. Whether it's managing menopausal symptoms, it's preventing unintended pregnancies, controlling diabetes, having access to the right treatments empowers people to live healthier and better lives. Today's agreement is also about strengthening our public healthcare system for the long term and the principle of universal access that it's founded on. It's a health system where care is delivered based on need, not ability to pay. I really want to extend my gratitude to Mark and his team, to the Government of Canada, for working with us to make this vision a reality. We are looking forward to receiving the funding from Ottawa so that we can get started delivering these benefits here to people in British Columbia and continue together building a stronger and healthier future for everybody. It's my pleasure now to hand over the microphone to Ayandri Riddell from the BC Health Coalition. Thank you so much, Ayandri.
I'm going to meet this. I'm Ayandri Riddell, Director of Policy and Campaigns at the BC Health Coalition. The BC Health Coalition represents 800,000 people across the province, including frontline healthcare workers, seniors groups, service providers, unions, policy researchers, and concerned individuals who have come together around a mission to strengthen and protect the public healthcare system. Our members have been waiting and fighting for universal single-payer pharmacare for decades. British Columbia's decision to join the National Pharmacare Program is a historic win that is a critical step towards protecting our public healthcare system and strengthening our bargaining power. Many people rely on workplace benefits for drug coverage, but those benefits can disappear with job losses or cuts, a reality thousands could face as industries brace for the impact of Trump tariffs. A universal pharmacare plan can ensure people have access to the life-saving medications they need, no matter their employment status. Recently, one of our member reps, Rowan Burge, shared that although she has employer-provided benefits, she spent more than $10,000 to $12,000 out of pocket this year to cover the cost of insulin, testing strips, and her insulin pump, which is considered life-sustaining treatment for type 1 diabetes. And if she wasn't able to, she would probably die. When I told Rowan about this announcement, she was happy but urged that all the life-saving medications that people depend on be added to the program so no one is left behind. Beyond its immediate impact on British Columbia, universal single-payer pharmacare is crucial fiscal responsibility for our public healthcare system. By leveraging the bulk purchasing, we can drive down skyrocketing drug prices, relieve the pressure on public resources, and generate billions in savings. Drugs are the second biggest expenditure in our healthcare system, and Canada spends even more on drugs than on doctors and healthcare workers. US and other foreign-owned pharmaceutical companies take advantage of our fractured system to set prices high. By negotiating drugs prices through bulk purchasing, we can strengthen our bargaining power, which will significantly lower prices for medication. This is why every other developed country that has a public healthcare system includes pharmacare, and as a consequence, they spend much less than us. Pharmacare saves lives and money. Today, BC is providing a powerful precedent for the other provinces. The BC government's coverage of contraceptives was already an example and of the best version of pharmacare, and by using the additional funding provided by the federal government to include medications for menopausal symptoms, BC is laying the groundwork to expand coverage beyond the initial drug classes and move us closer to full universal prescription drug coverage. Now we need every province to step up and the program to be expanded so that we can benefit from the full promise of pharmacare. Thank you, and I'll be handing it over to Dr. Olivier from BC Women's.
Thank you, Ministers Holland and Osborne, and good morning, everyone. My name is Dr. Rachel Olivier, and I'm a nurse practitioner and clinician scientist at the BC Women's Hospital and Health Centre. As a clinician with the province's leading hospital for women's health and research, I'm fortunate to deliver care to women and people with diverse sexual and reproductive health needs. At the core of my clinical practice, I do my utmost to treat every patient equitably and without judgment. However, the reality is our system is imperfect, and we are always looking for ways to improve the care that we can offer. We know that an individual's socioeconomic status can determine whether they access certain treatments, such as menopausal hormone therapy. Limited access to care has tangible negative effects on both the mental and physical well-being of individuals. Today's announcement that an agreement is in place to further this crucial work is welcomed by me and by other providers, serving women and people in need of safe and equitable health care. I'm optimistic it will make treatments more accessible for individuals of various backgrounds, because evidence shows us that increasing access will also have much-needed positive societal impacts beyond the benefits to the individual. BC Women's is grateful to be part of today's announcement and for the ongoing collaboration between federal and provincial governments, along with healthcare partners, as we continue our work to improve health equity for women and people in BC and across Canada. I want to extend a sincere thank you to Minister Holland, Minister Osborne, and to both governments for their concerted efforts on this important health concern. With continued momentum and partnership, I am confident this work will have far-reaching benefits for communities across every corner of our country. Thank you. I will now pass things off to our MC, Jennifer Blatherwick.
Thank you, and I have to put out a thanks to Minister Holland, who covered my error. I forgot to acknowledge MP Peter Julian, who is joining us here today at the beginning. So with today's announcement, women, trans, and non-binary people have more access to medications that will have a positive impact on their lives. I think we've acknowledged that this announcement will affect hundreds, thousands, millions of people. But when I think about them, I think about specific people in my community. I think about Annie, who takes too long to come to the door when you knock because she has been battling diabetes for decades and rations her medication so carefully because each dose of medication is equivalent to her groceries. And I think of Samantha, who will be so grateful to hear that they no longer have to struggle with rent because now they will be able to afford the HRT medication that will make their day feel achievable. Thank you, and thank you for all that you do here in British Columbia. We have seen how hormone replacement therapies can greatly improve a person's quality of life when it comes to managing menopausal symptoms, and now thousands of people in British Columbia will have access to those medications without having to worry about financial cost. Today's announcement is excellent news and a great step for people living with diabetes and women's health in British Columbia. Thank you again to both Minister Holland and Minister Osborne for their ongoing efforts to better care for British Columbians. And thank you for joining us today. Minister Holland and Minister Osborne will now take questions.
Thank you very much. A note to media in the room, if you have a question, please join me behind the camera stands, and we will start here in the room. For media on the line, please press *1 to enter the queue. You'll be limited to a question and a follow-up. Pour tous les médias au téléphone, s'il vous plaît, faites l'étoile 1 pour signaler que vous avez une question. We'll start in the room here with Marcy Nicholson, Canadian Press.
Yes, good morning. Minister Holland, why is it that we're waiting a year for this to go into effect?
Well, this is what we're ready to do now. I certainly have let Josie know and the government here at BC that we want to go sooner, but we wanted to get a deal so that people can know on the 1st of March these drugs are coming. And that is an outermost date. Certainly we're going to seek support to accelerate it. But this is a forever and ever change. And this is something that is going to exist, I think, for all time. 100, 200 years from now, it will seem inconceivable that people didn't get the medication they needed. And so that's essential. And, you know, I have to say, we've been working at breakneck pace. This was only introduced a year ago. Just passing it usually takes 18 months. So I'm ecstatic that we're at the point that we're signing a deal today.
Thank you. And what's the main driver behind this?
Well, I think it's twofold. You know, for me, look, I'm deeply privileged, and I know Wilson and Ron certainly feel this way, Peter feels this way, to talk with people across the country, and it's devastating when you talk to a nurse or a doctor or a family or a patient, and they say, you know, you have somebody who wasn't able to adhere to their medicine because they couldn't afford it, and some terrible outcome occurred that shouldn't have occurred. Like, fundamentally, that should not be our country. And I think what's happened with pharmacare is because it's so big and there's so many drugs that we don't have a starting point. And so for decades, we've just been talking. Now we put into reality these drugs, and we're going to have an opportunity to be able to evaluate. And let me talk about BC's leadership. You know, BC moved first in the country to say free contraceptives for women everywhere in the province. The early indications is that program is saving a boatload of money. And that's why I don't even understand the debate on this. This is about really doing two things simultaneously: improving our health system and making sure that people stay in wellness rather than disease, and two, break the ridiculous way that we currently manage things, which is wait for people to get sick and then spend obscene amounts of money caring for them once they're ill.
Our next question comes from Rob Buffum, CTV News.
Well, thanks for taking my question. It's a pretty specific one, but my understanding is that people who have their pancreas removed have what's called type 3 diabetes. I heard type 1 and type 2 mentioned as being covered for equipment. I wanted to confirm, my understanding is currently if you have type 3 diabetes, which is probably the most severe type, you're actually not covered for these products. And I wanted to confirm whether this announcement means that you would be covered for, you know, things alerting you about your insulin levels and things like that.
Yeah, the intention is the intention of this fund is for all types of diabetes. So that there are, as you quite rightly have referenced, many different types of diabetes. And the idea in the creation of the devices fund was to help improve access. It's not and to reduce costs. So it's not going to fix everything, but it is going to be available there for folks writ large. And I don't know if Josie, you want to add anything, but I think certainly folks should expect relief across the spectrum.
And just kind of following up on Mercy's question, so for folks who are looking forward to having things like contraception or these diabetes products covered, the wait will be 1 year from now?
So contraceptives are now, so BC's already doing that. So that BC's out of the gate, and this agreement recognizes their leadership. And one of the reasons we're able to do more here, because, you know, when we were negotiating for Ron and Wilson and Peter, when we were negotiating pharmacare, we said diabetes drugs, devices, strips, you know, related materials, and contraceptives. But because BC was already doing contraceptives, we're able to take the money that would have gone to contraceptives and allow us to do hormone replacement therapy. So contraceptives are now. That's something that BC was already leading on. This is the next step in that journey, and the other drugs that I mentioned, which are beyond what was contemplated in Parliament, will start at the latest in the 1st of March of next year.
Next question in the room comes from Andrew McLeod, the Tyee.
Yeah, hi, Minister. You were out here a few months ago announcing the Memorandum of Understanding. Today it's an agreement. What's the difference? What's changed there? And you mentioned in your comments about it being secure for generations. How safe is this from a change of government?
Yeah, great question. So first of all, on the Memorandum of Understanding, The idea was in a broad outline to give people a sense of what a deal might look like. And at that point, it was non-binding, but it was the two governments entering into a common understanding of what we wanted to do. And I really want to thank BC because, you know, as all of us, Ron, Wilson, Peter, and all of us were working through the process in the House of Commons, it was critical to be able to show senators, as we were moving through the Senate process as an example, how that might function. So the difference here today, it's a signed deal. This is happening. This is real. This is not coming to an understanding. This is a transfer of money and an agreement that Josie and I will very soon be signing just in the next couple of moments. Let me talk about a change in government. That always is a possibility, but I would say it is madness that this is even a debate. I mean, first of all, this will have been a signed contract, and I think there is a long-standing practice that you honor the agreements that previous governments signed. So that's in the first order. And the second order is the Conservatives' chief criticism of pharmacare has been that it doesn't exist and that it's not real. Well, it's real. They have the same criticism around dental. So I think they actually have to look patients in the eye and tell them what they're going to do. And I would say there's a lot of diabetes patients, frankly, they don't care about partisanship, right? And their families don't. They care about being healthy. They care about making sure they don't get sicker. And certainly, I think Canadians writ large want us to manage money well and to make sure that we're transforming our health system. So, you know, if their position is they don't support people having diabetes medication, they could come out and explain that and explain why they don't support it. But it's, you know, it's up for them to explain that.
Sure. And you had a sort of a roadmap from Eric Hoskins to what I would call like a full pharmacare program that would cover, you know, the hundreds of drugs that people take, not just 3. Instead, you've gone this route of picking off a few things instead of a broader plan. Why?
Well, it's important, I think, to think of this as stages and gates. We have a committee that was part of the legislation that was passed in the House of Commons that's going to take a look at sort of the whole picture and make recommendations on it. We have a pharmacare agreement in Prince Edward Island on another model, and now we can build evaluation around this and really see what its impact is. Because I think one of the things that become very difficult is there's a lot of hypothetical discussions, like maybe this is going to work, maybe it's not, I think it's going to have this kind of benefit, somebody else doesn't think so. Now we're going to be able to do it in data, right? And it's, to me, on its face, making sure that people don't get sick and don't die, that's a pretty compelling argument. But you add to it, I think, the fiscal argument that's going to be made around this, then it's really going to be able to set the table to take those next steps. But I would say the reason we haven't made progress on pharmacare in decades is because, A, we got to work together, right? We got to collaborate. And I really want to commend Josie and the government of British Columbia. Their question is all about collaboration, working together. How do we find common ground? That's the approach we got to take. And then the second reason is because it's so enormous and so large that we don't quite know where to start. So this is about making sure you take those steps. And that is the story of Canadian healthcare. We got to where we are by taking iterative steps and iterative improvements, and we can never stop that journey. I would say we need to accelerate it.
Next, we'll go to the phones. We'll hear first from Tessie Sanchi of the Hill Times. Go ahead, Tessie.
Hi, thank you for taking my question. Minister Holland, I'd actually like to ask you about the tariff situation and how it applies to healthcare. I'm sure you've been talking to organizations about their concern that the tariff war could really hit healthcare products. What has your message been to these organizations, and can you provide some insight on the conversations you're having to make sure that there isn't a significant hit on, you know, what we import for our healthcare systems?
So I missed the beginning, but I think I got the question. Look, this is a illegal and unprovoked trade war that's having a very serious effect on both economies. And one of the things that we have to do is to end it writ large. It makes no sense. It is in our common interest as Canada and the United States to work together for the betterment of our two countries. This is a time, look, we just came out of COVID. We had global inflation. We had Russian aggression in Ukraine. We have a situation that's just disastrous in Gaza. Like, we need to work together on a rules-based order as democracies to solutions. And so we've always worked in common with the United States. We have very deep and close relationships. And I'll say on the health side, how integrated our supply chain is. And this isn't just affecting businesses, this is people's health. And in a trade war that makes no sense, it's bad enough that there are economic consequences. We have to make sure that people's lives aren't put at risk. And we have to make sure that as part of this unnecessary war, that we don't have a circumstance where there is loss of life or people winding up in a deteriorated health condition. So we're having very positive conversations with Canadian suppliers, with the American administration around these principles that I think just make sense.
Tessie, do you have a follow-up?
Okay, no, that's it for me. Thank you so much.
Thanks very much. We'll go next to Richard Zussman, Global News. Richard, please go ahead.
Yeah, this is a question for Minister Osborne. Minister, we understand you sent a letter to Summerland denying funding for a primary care centre, and you in essence told people there to go see a doctor in Penticton. Why did you send this letter to Summerland, and is it appropriate to ask someone to go seek care in another municipality?
I think everyone knows just how much investment we're making in expanding our primary care system here in British Columbia. And of course, yesterday's budget shows a lift of $433 million towards that, and ensuring that we have the funds to operate all of the new facilities that are being built. We're deeply committed to building out that system, and that means attracting and retaining, training new doctors, nurses, nurse practitioners here in British Columbia to ensure that those people are there, and then working with health authorities and local communities to make the best decisions about where clinics are located. We're going to continue that expansion with the urgent and primary care centers, expanding community health clinics, and all of that work. So, of course, we'll continue to work with Summerland and Interior Health and making the best decisions possible, because people need care close to home. We know that, and that's the work that we're committed to doing.
Follow-up, Richard?
Yeah, but the people in Summerland don't feel that. You know, they're in essence being told by you, go to Penticton. So what are you waiting for in terms of additional information to provide the people in that community so they don't feel they need to go somewhere else for their healthcare access?
Well, of course, the people of Summerland need that health care close to home. They have some now, and of course, we're committed to continuing to expand that out. And that's for the entire region. We're dealing right now in an environment where we have a global shortage of healthcare workers. We're working with health authorities, we're working with primary care networks across British Columbia to make the decisions where we can invest resources to keep that healthcare close to home and ensure that people can get it when they need it, where they need it. We're going to continue that work. There's no doors that are closed for Summerland, and we're going to continue to work with them.
Thank you very much to all the media. Thank you very much to everybody for being here today. Merci beaucoup. That concludes today's event.
Thank you so much, everybody.
And now we'll sign.
And now we'll sign, yeah.
Let me just sequence everybody.